And everybody is still connecting. Everybody's here. Awesome. Hello, everyone. Thank you for joining us here, despite the lovely weather outside. Maybe you're even sitting outside here, joining us for this informational session. This session is hosted by the International Welcome Center North. I work there. My name is Marjolein Wiersma, and I'm the Business Support Officer for the Welcome Center. We are the expat center for the Northern Netherlands. And what we do is we do a lot of information giving to internationals who come and study and work in the north, so Groningen, Friesland, and Drenthe. So if you have any questions about living or working in the Netherlands that's not related to today's session, you can always head to iwcn.nl to ask those questions. We have a live chat on workdays from 9 to 5. But today is about the Dutch health insurance and the Dutch GP. And to be able to really go into detail and ask and get all of your questions answered, we have asked some experts from Zorgverzekeringslijn and from Studentarts. Zorgverzekeringslijn means health insurance line, which is a place that you can call. And Studentarts is, of course, a GP office. And they can answer all of your questions that you have. And I want to quickly point out where you can ask your questions. On the right-hand side, you see a bunch of icons. You see a chat. You can say go hi in chat so that we all know that you have found the chat. So feel free to say hi there. And what you can also see on the right-hand side is a questions tab. And if you click on the questions tab, you see that you can ask your questions here, all your questions here. And it's a great way to ask your questions there because other people who also want to see your question answered can give that question a thumbs up. So if you click on the questions tab right now, you see me having said all your questions, which isn't a question, but feel free to click the thumbs up there so you know, like, oh, okay, so when I click on the thumbs up, I indicate I also want to see this question answered. So it's definitely the idea that during the presentation of Kumi and Anna, you already ask your questions in the questions tab. The things, they can be questions, but also topics that you really want them to say something about. Feel free to already put those in the questions tab as they're talking so that we sure that we discuss the topics that you find important, that you want information about. Now, without further ado, we're going to start with a presentation about Dutch health insurance. And so put your questions in the questions tab. After Kumi's presentation, she will answer a bunch of those questions. And then at about half past 8, we go over to talk about the Dutch general practitioner, the Dutch GP, and you can ask those questions. So, Kumi, take it away. Over to you.
Yep. Hi, my name is Kumi. I work for Zorgverzekeringslijn, which is a subsidized organization. We are subsidized by the Ministry of VWS, which is the health department in the Netherlands. And I'm going to share a PowerPoint with you. It will be, I think it will be also available to you. If not, then contact me at Zorgverzekeringslijn and I will send it to you. One moment. And there it is. And I'm just going to click. We're going to talk about the basic Dutch health insurance, just in short, just to explain a little bit about how it works and why it is in the Netherlands. It is a system of solidarity, which means that everyone in the Netherlands who is insured under the WLZ scheme is supposed to be insured with a basic Dutch health insurance, and you are insured under the WLZ scheme if you are working or if you are regarded as living. And living, of course, everyone is living, so that's a little bit strange if you consider regarded as being living. But it's the term that the SVB, the Social Security Office, uses in the Netherlands to determine whether you are insured under the WLZ scheme. You can be staying in the Netherlands as an international student or as someone who is not working in the Netherlands, or being regarded as working. So someone who is working for a Dutch company. If you're working for an organization in a foreign country or outside the Netherlands, and you're also being paid from that organization or company, you are not regarded as living in the Netherlands, but as staying, because you are not part of the tax scheme, etc. So it's important to determine what your situation is. And if you are considered to be under the WLZ scheme, you are supposed to take out the basic Dutch health insurance. The elements of the basic Dutch health insurance are determined by the government, and they are helped in choosing which elements to put inside the Dutch basic health insurance by the Zorginstituut, which is an organization that researches what is important for the Dutch people, what do we need, what do we want to have insured for the basic Dutch health insurance. And it's compulsory for everyone who is insured for the WLZ. And the premium every month might differ. And the reason why it differs is because there might be less choice, as in which hospital to go to or which physical therapist to go to. Or you might have an online internet insurance, which are cheaper than the ones that have a customer service, which you can call, or maybe a shop where you can go to in your city. So the premium is, you have to pay the premium every month. It differs in price, so check what suits you best. If you like an online internet insurance and you don't need that much contact with them, you are comfortable with using WhatsApp or anything like that, then a cheaper one is useful. If you do enjoy talking on the phone maybe, or going into an office and asking them one face-to-face, then a more expensive health insurer is useful. There is a compulsory minimum excess of 385 euros. If you go to the GP, it is not used unless the GP sends you for a blood research or anything like that. Then you will have to pay it yourself from the compulsory minimum excess. And there is a voluntary access. Many international students choose for the voluntary access, but keep in mind that you will have to pay 885 euros if something goes wrong. And something goes wrong might also be riding your bike or just walking around and being hit by a car. There are additional health insurance policies you can take out. Some are for the dentist, glasses, contact lenses, physical therapy, and vaccines. Look at the acceptance. So the health insurers do not have to accept you for the additional health insurance. They must accept you for the basic Dutch health insurance. They are not allowed to tell you, no, we don't want you because we know you are, for instance, a diabetic, or you will need a lot of care. They are not allowed to say that for the basic Dutch health insurance, but they are allowed to say that for the additional health insurance. So check out the terms of the additional health insurance policies, because there might be some small print telling you that maybe some of the procedures at the dentist are not included. That's usually the reason why it's a quite cheap one. So look at the terms, it's very important. If something happens, you can call 112 and they will refer you either to a huisartsenpost or to the hospital, or you can go to the GP. If you go to the GP, it will not cost you anything from the excess. If you are being taken by the ambulance to the hospital, it will cost you. So make sure what happens, make sure that you know that you will be getting the bill for the 385 euros. And it's important to call 112 or go to the GP. Do not go to the hospital yourself, because usually it will they will send the bill to you yourself, because all care in the Netherlands goes through the GP. And when you are in the hospital, most of the bills, we will not see them because they will go to your insurer. Are you not insured and something happens to you, you will see these bills, and they are not small in the Netherlands. Everything is very expensive. Physical therapy sessions, those are the bills you might see, because they are usually in an additional health insurance and not in a basic Dutch health insurance. Ambulance care, more than 800 euros for bringing you to the hospital, and the hospital bill 5,000. Usually the hospital sends the bills to the insurer. If you are here with an international health insurance, you might encounter problems at the hospital and they might send the bill to you first. If you're from a European country, be aware that you can send the bills to Zilveren Kruis. I will share the link, or I will give the link to share later on. I will put it in the chat. And it's important to you don't have to pay them yourselves. You can send them to the Zilveren Kruis if you're here with the EHIC card, so the European Health Insurance Card. Another part of the health insurance program is healthcare benefit, which is possible for people who have a low income or no income in the Netherlands. Only if you are eligible for the health insurance, for the basic health insurance, you are allowed to take out the healthcare benefit. Make sure to know that it is linked to your income. So if your income changes, for instance, you only work once a week, and maybe you start to work full-time because of the summer period, there are no classes, you decide to, or maybe your income becomes bigger, then make sure that you send in the changes within 4 weeks, because the tax office can fine you, and they can fine you up to 5,514 euros, which is enormous. This is what we do. So we give training, we give advice and tips. You can call us. You can also call us from abroad. We have a chat function on our website, and you can email us if you have any questions. The flyer you see on the right-hand side, we can send it digitally to you if you have any problems paying your health insurance bill, and we can explain things to you. And if there are any questions, I hope to see them in the chat, or let me stop the sharing. And how do I
would say we'll give people a minute to think and to write up any questions in case they have them. Okay. And if say maybe during you can't think of a question now, but maybe during on this presentation you do think of a health insurance question, feel free to still ask it, because Kumi will stick around. But if you have a question right now about health insurance, how it works, how something works, how additional packages work, feel free to ask the question, or to put it as a topic under the questions tab or in the chat. Either are fine. So Juan asks, what about psychological care? Could you say something about that?
Psychological care, most of it is covered in the basic Dutch health insurance, but it depends on what kind of health insurance you have. So if you have an international health insurance, if the psychological problems started when you arrived in the Netherlands, most of it will be covered. If you already had those problems and you did not tell the international health insurer, then you have a problem, because it might not be covered. So it depends on what kind of health insurance you have. Marjolein, you are muted.
I am muted. So smart. Lana asks, what is considered a low income for the healthcare benefit? Is it also available if I have a paid internship?
If you have a paid internship, your internship payment, monthly payment, should be equal to the minimum wage in the Netherlands. If it's not, then you're not allowed to take out a basic Dutch health insurance. So if it is if it is equal to the minimum wage in the Netherlands or higher, then you must take out a basic Dutch health insurance, and you are able to take out the healthcare benefit. And if you are working, then it doesn't matter how high your income is. If you only work 1 hour a week, it is enough to take out the basic Dutch health insurance. Actually, you must take out the basic Dutch health insurance then.
Check. And Julie asks, if I want to go to a dentist and don't have it covered by the health insurance, what can I do?
Go, because you are allowed to go. The bill will be sent to yourself. So make an arrangement with the dentist and just talk about it and explain what you want, what you need to have done. The dentist will give you a plan. He will look at what is possible and will also give you the prices. So it's like going to the groceries. Just check what you want. tell them what you want, and they will be able to make a package for you as well.
Check. And by the way, if you get the answer to a question and you're like, I would like more information, feel free to follow up. And Julie is following up, so she asks, so I do not need to go to a GP first in order to go to the dentist?
No, a dentist is completely separate from the GP, as is the physical therapist, I think, Anne, because you're allowed to go to a physical therapist without being referred to by the GP, I think. So.
Yeah, because it's just like if you don't go to the dentist, we see a lot of young people. You have to go there because it's an investment. If you lose your teeth when you're 30 or 40 years and you had never been to a dentist, it's not wise to do. So you always have to go for when you're young or when you're old, because if you don't go, the damage will be more. So we really want people to have, when they're 60, to have their own teeth, and the only way to manage this problem is to go there and pay the bill. And if you're not insured, well, yeah, then it's an investment in yourself, I think.
Yeah.
Yeah, and just remember that just a checkup at the dentist is usually around 20 or 25 euros. So if they don't have to do anything, but they just check your teeth and tell you what is wrong or anything like that, then that's about the price.
But you have to do it yourself. There's no system appealing to you, so you have to. It's your own responsibility to go there if you're in the Netherlands, unless you're in the system of a dentist who will call you each year to go there. But we regularly see people who go to the GP for teeth control or in their mouth, but the GP is not the location to go. You have to go to a real dentist.
So that's very good to know. Marcel asks, what about when there is a dispute between you and the health insurance, whether a service should be paid or not? Is there an ombudsman or something similar?
Yeah, I just answered it in the chat. You can go to the SKGZ, the skgz.nl, which is the ombudsman of the healthcare system. Actually, they are my boss because Zorgverzekeringslijn is part of SKGZ. If you have a problem with your health insurance company, which must be a basic Dutch health insurance, you first file a complaint with the health insurance company, and if you receive an answer which you are not satisfied with, then you go to the SKGZ and you can start a file with them, and they will, without any payment, so freely accompany you to see if they can change the minds of the health insurer. And if that's not possible, then you can also go to court with them. So the SKGZ will accompany you, and it will be, I think, 37 euros, something like that. So it's very low, very cheap, and the health insurer has to apply with the wishes of the SKGZ. If the company if the organization tells the health insurer that they have to change something,
Which is very good to hear. Then Elena asked, is it true that you can be charged even if you write the doctor an email? It happened to me at Studentarts
No.
to send an email and to ask if it's necessary to see a GP, which was recommended to me before, and I was charged the money for a consultation.
Mm-hmm. Well, I take that question because I understand the question. Because of Corona, we see a lot of foreign students with questions, email questions. And these are medical questions, has to be treated by a GP, they have to be registered in the system and have to be taken care of with prescription and all kinds of questions. So when somebody is consulted, has a medical question, we charge them, it's not for free. So mostly the insurance company like AON or Silver and Kruis pay the bill, and we send the bill to them. And there is, if you don't have any insurance, then you have to pay it yourself. So I can't. That's the reality, and the only thing you can do is to discuss about the amount due. But we have a lot of questions from foreign people, and they think, well, we can do that for free. And so that's not true. They have to pay something. You have to know their insurance numbers and so on. And there can be more if it are serious problems. Then they come to the practice, and they can go for free. So the only people who have to pay are people who don't have any insurance with them. So it's the same as with the dentist. If you go to the dentist and you have no insurance, you have to pay it yourself. But I think about 95% of all our foreign students have an insurance, and they go for free.
Check.
That's a reality.
And then Antonio asks, are there some benefits for students for the insurance?
That depends on what kind of insurance it is. If it is a basic Dutch health insurance, you are eligible for the healthcare benefit, which will go up to 107 euros a month, and that depends on your income. If you have an international health insurance, there are no healthcare benefits because it is not connected to the Dutch system. So you will have to pay it yourself, which is usually a lot cheaper than the Dutch basic health insurance. So if you take out the liability health insurance and the repatriation, which is usually part of the international health insurance, then the healthcare part is around the same amount as it would be for the basic Dutch health insurance with the healthcare benefit.
Check. And then Laura says, I just changed my status from student to worker. And also, I moved from city in the Netherlands and I just bought a health insurance, but I'm not sure if I have to ask for an appointment with the GP to start again my record or how that works.
I think Anna can answer that one.
Sorry, I mean, the question was that she has to start a new question with a new GP, or?
Laura,
Yeah, she moved city.
Yep, go ahead.
Yeah.
So I think when you move a city, you will have to find a new GP, but you do not have to start all over again because your old GP will be able to send a file to your new one. So you will have to ask the old one to send it through to your new GP. And then maybe you will have an introduction meeting or something like that. If you wish, you can make an appointment, I think.
Yes, we see a lot of foreign people who are signing in each time they want a consultation, but you only have to do it one time to register, and then they ask their old GP to send the documentation to the new GP. And it's wise to have the GP in the city where you live because that's more easy, because then you can reach them easily when you have a medical problem.
Check. And Julie asks, will the bill from the GP be forwarded directly to the health insurance, or do I receive it first?
In our system, you won't even see the bill. The bill is directly sent to the AON or Silver and Kruis. Or when you have a Dutch GP, then it's for free, the GP consultation. So you won't see any bill at all.
Will that differ? So in your system, is that the Dutch health insurance or the Dutch GP system, or is that Studentarts?
No, it's a free choice. We are one. It's possible that the GP is, if you are, he's sending directly you the bill, and you have to pay, and you get it back from your insurance company. That's a possibility, but we send the bill directly to the insurance company, because that's not an all GP practices the same routes. Sometimes you have to pay directly. Sometimes you can go for free. And sometimes when you ask a question and you're in another city, then you have to know it's not for free. That's healthcare. There is a price on it. If you are on holiday somewhere else, you go to a GP or to a hospital, or so it's just like Kumi told. It's very expensive if you are there.
Yeah, maybe good to know if you are a European student and you have an EHIC card and your GP tells you you have to pay it yourself, then save your bill and send it to the address I will place in the chat right now. Because this is the organization that processes the bills for the EHIC card, and you can send your bill there and they will refund you.
Very good to know. By the way, we'll be sure to also send this information again after the presentation, so you can copy it from the chat now. But in case you you forget or you missed it, we'll send it again afterwards tomorrow. Julie asked, is it necessary for the GP to have your BSN number?
Yeah, maybe Anne can answer that because it depends on what kind of insurance you have.
Yes, it depends. The AON is not necessary, but for the Dutch system, you have to have a BSN number, and well, that's the situation.
So the answer is yes.
Well, if you are an AHEC member, then you can send the bill. This number when you're no, it's not necessary if you're ANN. You're here for a travel insurance for a short time. Then it's not necessary to have a BSN. But otherwise, if you are really living in the Netherlands for a long time or working here, then you have a BSN to get in the Dutch healthcare system registered. Because if you don't have a BSN, you won't be accepted.
Check. Then Juana asks, I'm planning to relocate to the Netherlands permanently. I was planning to get my medical records from my GP in Romania. Would it be all right recommended to have them translated and give them to my Dutch GP? And should the translation be English or Dutch?
Well,
very specific.
If it's in the Romanian language, it's a bit a pity. But there's Google Translate, and the GP uses a lot, so it's possible to translate it when it's digital. But yeah, you can do it yourself. Put it through. So everything is possible. But you have to, if you and you have to think about medical records. Not always it's necessary to have the complete files from 10 or 20 years ago, because the GP, it's of no importance to read all this stuff. Only if it's necessary for the new GP to know this information, then you can translate the most relevant pages, for example, and send it digital to the practice. So I would recommend that, because we receive sometimes medical records about 100 pages and with 20-year-old little stuff, and they're not relevant for the medical treatment. So it's a bit stupid to give everything, all the information to the GP, and then he will be give a better consultation, because the reality is you're really looking at your medical situation at the moment, and not 20 years ago. But there are diseases that are important to know, of course.
And then speaking of medical files, Elena asked, is it true that we cannot see our own medical file in the Netherlands?
No, and there are a lot of facts. One, the medical files, the owner is the patient himself or herself. So he always has the right to get a copy or to see how the file is, what's in the file. So that's one. Second, there is in the Dutch healthcare system a lot of practices you can, with a digital safe, secured way, you can look in your own file. You can see the most relevant things like medication or other stuff. So there's a transition now that a lot of patients can look their own files, but we know from our experience that most patients are not really interested in their own files, but they're interested in contact with the GP and the treatment plan, and not to read all those medical terms and things in their files. So it's overestimated to think that all the patients want to read their files. They just want to be sure there are no stupid things inside and they can see it. But for the medical treatment, the patient we see all the patients, they're looking at Dr. Google more than their own files. Yes,
so at least
reality.
it is. So the idea that it's not possible to see your own file, that's not correct. You can
Correct.
see your own medical file.
You can always see your own files, but you have to think about the importance of that fact. If that's the most important thing to do about your own health.
Check. Marcel asks, how common are digital procedures like digital prescription and referrals to specialists, etc., with GPs? Does this vary from GP to GP? I would want to avoid to go every single time to my GP's practice.
Yeah. We know that that's always this COVID situation. People were not allowed to go physically to the practice, so you have to do it online and by email communication or email interaction. So I think we saw that about more 80% of all the questions you have a GP practice can handle it online or in a digital advice. So it's convenient not to go there if it's not really necessary. If you send pictures of a small, because it's more objective to judge and to give it the right medication, and it takes less time for everybody to go there. So the practice is judging if it's really necessary. You have to go there, but due to COVID, we more than a year we didn't see a lot of foreign people, but they just got an online recipe or an online advice or an online communication. And we know now that 80% of all those digital communication will be enough. Only in 20% of the cases you have to go physically to the GP. There's a problem with physical, like treatment of if you have mental problems, then a lot of people want to see face to face. But even then, online treatments is coming up. There are a lot of apps you can find on the internet, or there are a lot of sites like the site info@gp.nl, and you can find a lot of information yourself about the things you have. And we see most foreign people have their own diagnosis already. Sometimes they're wrong, but a lot of times they're true also. So that's the
So,
reality. Yeah,
so students
the answer is
went
yes.
digital very much. Would you say that's the case for most Dutch GPs?
I think this year a lot of GPs learned to do things online and give uh, email advice or email prescriptions. So I think yes, there's a kind of transition to more digital, less face to face. But there are old-fashioned practice who do 100% face to face, and you have patients who really want to go face to face because they know their GP very well. But like in big cities, there's no tight connection between the GP and the patient, and then it's very common and regular to do things online. And I think they're really satisfied with the solutions they get. It's less time, it's efficient, you can communicate, but you have to do it directly. You don't have to wait weeks for the answer at an email, but then you don't take it serious. But COVID gives some really speed up the process of digital healthcare.
Check. Sabrina asked, should I contact the GP if I'd like to have a checkup with a specialist?
Yeah, well, that's a cultural thing because a lot of patients or foreign people, they are biased and have prejudice about checkups because they think when they have a checkup, then they're healthy. But the Dutch GP system is other way around. They think you're healthy, you don't need a checkup. So you think different. And that's the point. When you get a medical checkup, most blood testing doesn't say anything. There are no real facts coming of that. So the idea that you get a lot of testing, you will be more healthy, you can have a discussion on that if you're a healthy person. So you can have a medical check, you can have testing, and the day after the testing, you can be ill. So there's no guarantee by medical testing. So the idea that medical testing will prevent illness or other things is a bit it's not a reality. It's overestimated. But it's possible you can get blood testing like Kumi said, you have to pay for it yourself at the lab. So there are everything possible. There are a lot of possibilities, but the Dutch system is in their ways. Dutch GPs really don't want to do a lot of testing if it's not necessary, if there's no reason why you should do that. So it's a bit stupid to do things if there's no reason. But if you're worried about things, well, then it can help to solve the situation, and you have the testing and the results, then you can get it very clear, see you're not ill, and so it will have the evidence for your health situation. But it's possible, but it's not as easy and it doesn't give the results you think you have in a lot of cases. Most
And
blood
that's
testing in the Netherlands, you find nothing in 90% of all those testing. So that's a reality.
so that's about general checkups. And to kind of ask another more specific question,
Yeah.
if you would just want to get in touch with a specialist, maybe you
Mhm.
already know you have a certain condition, can you
Mhm.
go directly to the specialist, or do you
No,
have to go through
you
the
have to
GP?
you have to go to the because there's a difference in the Netherlands. The GP is a highly educated health person. About 95% of all the medical questions, issues he or she can handle themselves. So there's no reason to go to a specialist in the hospital. So you have to go there, and the GP give you a referral to the hospital, to the specialist, and that's not the same as in the country where people are from, because Netherlands has a special position in that way. So it's you have to go to the GP, then he can send you to the hospital if he thinks you are ill, but if he's thinking you're not ill, or she, then he's thinking, why do you have to go to the hospital? Because they can give you medication, they can do surgery or other things, and is that the way you get healthy? So there's a gateway. He's the gateway to the hospital, and he will do that very, very reasonable and with a lot of sense, because they are highly educated. Because in foreign countries, all the GPs in China, they don't even have a GP. They're sending people directly to the hospital, and that's different here, because that's the main point of the Dutch healthcare system, that the GP is the gatekeeper of the healthy people, and he prevents them to go to the hospital for nothing.
Yeah, and keep in mind, if you do go to the specialist or to the hospital directly without going through the GP, the health insurer, if you have a basic Dutch health insurance, might choose to have you pay all the bills. Because if there is no information about you going through the GP to the hospital, then the health insurer might give you the bills themselves, because it's the system in the Netherlands, and because of this system, they can keep the cost low. And if you go directly to the hospital, then they will bill you yourself, and you will not be insured for that. So it's important to know that always go through the GP whenever something happens. Or if it's urgency, a medical urgency, then call 112, because of course then you don't have to wait until the GP opens, which is quite necessary.
Exactly. Oana says, I've read something about ADHD medication being subsidized. How does that work? Is it covered by the insurance? Will I pay for it and then be reimbursed? I've never taken prescription medication before, and I have little information about that.
Well, it depends on the insurance company, I think.
It might be that it is covered in the basic Dutch health insurance. So the coverage would be all equal for everyone who has a basic Dutch health insurance, but that depends on what has been put into if it is inside the package or not. Most important in the presentation you just saw from me is the website link to Rijksoverheid, and it's called what exactly is what is covered by the basic Dutch health insurance. If you look at the website and only use the website of Rijksoverheid, because there are so many websites from health insurers who show you what the coverage is within a basic Dutch health insurance, but they always make it very glamorous for themselves so that you take out that policy. The only correct information is from the government, from Rijksoverheid, so it would be wise to go to that website. If it's not in there, then it will be for an additional health insurance policy. And then it depends on which health insurer you choose, whether it will be refunded or not. So you will need a little bit more information about specific medication. And any health insurer will be able to give you a list of all the medicine that they cover. What exactly is covered in the basic Dutch health insurance you will find on the website of Rijksoverheid.
Check. And then Elena mentioned something which I think more internationals have this feeling of, that they're not being taken seriously by their GP. She says, I understand that you want to minimize the tests and the pills that you give, but I had a really bad head pain and a swollen part of the skull, and I was told as long as I can feel my limbs, I am fine. I don't want to get to that point where the problem is so bad that I can't move. Isn't it better to treat when it's still at the beginning and it's easier to treat? Sometimes I ended up crying because I was scared and I didn't feel like I can get help. And this is something that we've heard from more internationals, this kind of feeling of, I don't know what to do because my GP does not take me seriously. What to do at that point?
Yes, she's got a point. If you if you're in the directly and in the beginning you get the right treatment if necessary, then it's better than to wait too long. That's one coin of the one side of the medal. On the other hand, a lot of illness will be in the time when you ask people a week after their first complaint, then it's gone. So that's the other side of the um, of the reality. So I think she got a point, and I think that if it's always a GP takes patients seriously, but sometimes there's a cultural difference in the way you have to be treated, because not for all the illness there is a medication. The Dutch antibiotics, they're not giving it easily if there's not really a way to give them, so they're reluctant. I think the Dutch GP will take it seriously, but perhaps not the way you think as a patient what you need, and there can be a gap. But I agree with her. Every patient has to be taken seriously, and if the patient will be their own doctor, it's a good case, and she knows the best her own body, and then the GP has to be really explaining why he or she is doing the things she's doing, because it's with a reason, and sometimes it's lack of time, sometimes, but I think sometimes the GP really thinks, well, I can't give you what you want because it's not good for you. And then there's a sort of kind of discussion, and the interaction is really important. They have to be taken seriously. That's always true.
And so what can somebody who doesn't speak Dutch, if they feel like I'm not getting the information I need or I'm not getting the treatment I need, what would you recommend that they do or say or ask?
Well, ring a bell, make it clear, send. So be honest, and ask for interaction, discussion, because I'm not taken seriously can be for 100 different reasons, or sometimes it's okay, then something has to be done, but sometimes it's not true. So explain why you think you're not taken seriously, and sometimes there is no direct solution. Just the GP is trying. Well, we take that treatment and it doesn't work, and I'm thinking, but he's looking for what he always can go back. So when the GP is telling you, well, I think there's nothing at hand, and you stay illness, mentally or physically, then you can go back and tell the GP, well, your treatment doesn't work. What's our next step to do? So there's always, it's not one thing and it stops, but it's your own medical processing. You have to tell it.
So that's something you do as the patient. You can take charge of the process.
The patient has to be the leader of the process and is responsible and has to tell the GP what he or she is expecting and interact. Not not saying, well, I want this to be done, but listen to each other, and then we will see there's a reason why people behave like they do. So I think the patient is the first, and you can go to other medical. There's the site info@gp.nl. There you can find all kind of medical possibilities and treatments. And if you as a patient think, well, I need this treatment, then you can ask it to the GP again. So you saying, I don't need medication, but I think I need this medication, and then there's a discussion about that, because there's no reality that the patient is always right. And there's also a reality that the GP sometimes has to explain why he or she is doing the things he's doing.
Yeah, and maybe a little practical advice, as I experienced with a lot of international students here in Leiden, where I live. We have a huisartsenpraktijk or huisartsenpost, which is the connection center when you need a GP, but they are closed. So in the evening or in the weekend, if something like that happens to you in the weekend, then you can always call them and just discuss with them what is happening to you and why you need treatment. Sometimes it's nice to talk to another GP without paying, because that's the interesting part about it. If you really need medical urgency or medical help, then it's nice to call them and just talk to them and discuss whether your problem really needs to be treated right now because you're worried about it. we hear a lot about young people who do not go to the GP because they think it's costing money, and they just don't get the treatment they need because they delay it, or they think, okay, maybe next month I will go because I cannot get my medicine because at the pharmacy I need to pay myself. There are a lot of questions about that. So if you have questions about that during the day, then you can call the GP. You can also call Zorgverzekeringslijn. We can advise you whether you can go to a pharmacy, for instance, and pick up the medicine without paying. There are possibilities, so just talk about it and reach out to the people who are there for you. So also in the evening, also in the weekends, try and just reach out and discuss the problem, because if you keep it for yourself, then it will only get bigger and a bigger problem as well.
You always can try a second opinion. That's really a possibility, but be reasonable, because if 2 or 3 GPs say the same thing to you, maybe there's a reason why they're saying it to you, they're telling it to you. You can go on, but be reasonable also, because they do it with a reason. And really, when there is something at hand, they are trained to pick it up and do something with it.
So
And
could we
in this,
mention in Leiden you have the huisartspost that you can go to should you want a second opinion? What could you do if you are in Groningen and you would want a second opinion? Where would you go?
well, there's the doctor's dienst, but it's outside office hours, and then there are GPs working, but it's not intended to be there for second opinion questions.
Yeah,
But
so
you
where
can,
would you go with your second opinion questions?
well, I would just look in another GP in the same practice and ask again. If I was sure I had a reasonable complaints and it was not taken seriously, then I would take action, and perhaps I would arrange my own healthcare, and I also would listen to the real medical experts. If a second GP in the same practice would say the same thing to me, then I would think maybe they are right, and maybe I'm biased, maybe I've prejudiced, maybe there is no direct solution for my disease. I have to take some time. They haven't the real solution. And as a matter of fact, a lot of people are taking pills and medicine, but that's also poison sometimes when you take too much pills. So it's better to do the real natural thing, or do testing, blood testing, to see if there really is something at hand. Because in our experience, most of the cases, people who were a bit, they were felt not taken seriously. We really couldn't find a real medical underlying diseases. So the nature at the time was very gentle for them, and after a month it was taken away. But if it's persistent complaints, then you can go to a hospital, and then you need a medical specialist to take at that thing. So that would be the real way. And then I would ask the GP to send you to the specialist. If it's really persistent unrest and you have real complaints, and the GP can't handle it, that's a possibility, but
Check.
only in exceptional cases, not as regular healthcare to send everybody to the hospital because they want to know they're not ill and they don't have really cancer or other things or so. Because a lot of people are worried, but in most of the cases there's nothing at hand. And if there's something at hand, then something has to be done. That's
Check. So we have about 5 more minutes. We didn't really get to a presentation on your side, Anna. So I just want to ask, are there things that you really wanted to give to people who are visiting this info session that you really want to say that you haven't yet mentioned about the Dutch GP?
Well, I would just say be your own GP as a patient. Manage your own healthcare and take action if needed, and listen to medical people, and know that you are sometimes biased, and you can arrange on the internet. There's a lot of, but look at the good sides, the medical trustful information, and then you can arrange a lot of things yourself. For example, we have STD testing, and you can do it all yourself if you're worried about sexual transmitted diseases. we have a site and you can arrange everything yourself from A to Z. You don't need even a GP sometimes. You can get a lot of pills and medication without a GP. So think self what you really think it's wise to do, and then take action. So there's a lot of information you can find on the internet, but be really good information, trustful information. That's the thing you need. And there are sites on the website of a lot of GP practices. You can find a lot of information because the digital interaction is really taking place now. And because of Corona, there's a delay in the treatment in hospitals. And so it's difficult to get real operational surgery. Sometimes you have to wait. And that's a problem. That's a real problem. And even for mental health care, you can't get it directly. It's a real problem for foreign people. But then be responsible for yourself and dare to ask questions. And then I think the most practices are there to help you, and then they will listen, and then you get the best results.
Thank you very much. So Anna mentioned a couple of websites. I'll be sure to email those to you. I'll also be emailing you Kumi's presentation and of course the Zorgverzekeringslijn's number. So you can phone them about your health insurance questions and I will give you the information of Studentarts. They are a GP practice. So if you don't yet have a GP and you live in their area, then that's a GP that you can go to. If you have questions about health that are unrelated to health insurance and GPs, feel free to go to the Welcome Center's website, iwcn.nl, and we can refer you to the right experts. And if you have questions about other things unrelated to healthcare, about living in the Netherlands, things that you don't know as an international, is it different for you or not? Also go to our Welcome Center website. In the live chats, basically, we always know where to refer you should you want more information. If you are like, oh, there's other topics that I would love some information sessions on, we have 2 more sessions coming up. We have one about buying a house in the Netherlands, and we have one about doing your Dutch taxes. So if you would like to attend those sessions, each also has experts talking about these topics, so you can ask all your questions. Feel free to check them out on the Welcome Center website. Oh yes, taxes, Julie. It's the fantastic topic. I'll quickly post the link here, but I will also email that to you. We'll stick around, I'll say, for 1 more minute. So if you still have a question or a topic that you would really like to ask Kumi and Anna about, feel free to ask it now. And if you think of them later, you will get an email with their contact information and to the contact information of the Zorgverzekeringsline and the Studentarts. So don't worry if you suddenly in the middle of the night wake up and you're like, oh, I still had a burning question. You'll still be able to reach them. And as we're giving that final minute, is there still anything either Kumi or Anna would like to add as we're finalizing the session?
Well, take care. Yeah, sorry.
Yeah, I wanted to stress that if you are not eligible for the basic Dutch health insurance, don't take out one yourself. It's easy to take out one because you can go to the internet and just fill in the website of the health insurance company. But the problem is that if you take out a basic Dutch health insurance and you're not eligible, you will have to pay all the healthcare bills yourself. They will pay back the premium, but you will be taken out of the policy retrospectively. So don't take out one if you're not supposed to take out one. If you're in doubt, then contact us and we will be able to give you some information to see whether you need to take out one or not, or we will refer you to the SVB, the Social Security Office, who is the only one in the Netherlands who can decide whether you need to take out a basic Dutch health insurance or not. And if you are not allowed to take out the basic Dutch health insurance, don't take out the healthcare benefit, but because that one as well has to be paid back. And it's usually the start for a lot of international health insurance, international students becoming acquainted with debts. So don't take out the health insurance benefit if you're not eligible. That's the big warning sign here.
Well, and we have, yeah, go ahead.
One thing, just if you need a GP, take a GP nearby where you live, because it's complicated when you're far away. You have to travel a half an hour or in a car. then and you get ill, then the GP will not visit you at home. So there are some advantages to take a GP not far away, and take the GP you trust, and you know it in a couple of minutes. And nowadays in Holland, a lot of GPs are young women, and they work part-time, so there are different GPs, but you know from each other your medical files. So that's a reality too. So most young women, and they are very skillful and highly educated.
Thank you very much. And we have no further questions, so I would just say thank you so much, Gumi and Anne. Again, thank you for answering the many, many questions that came in and to give this information. Elena already mentioned in the questions tab, there's not super many presentations about this, which is also exactly why we wanted to give this presentation. It's info that you can find online, but it's always better to be able to ask questions directly to experts. And it's great that you now know where you can find them. And please, please, please also share this with other internationals that you know who may have the same types of questions. The links that I send you, absolutely feel free to send them on so that other people also get the opportunity, that they know where can I get information about how the system works. Because a lot of the frustration of internationals who come to the Netherlands and who have to deal with the healthcare system is that it's different from back home, and your expectations are different. So it's good to know exactly what you can expect and where you can go for which type of healthcare. So send it on, share it with others. If you have further questions, you'll know where to go with them. And for now, thank you very much for attending, and have a fantastic evening. And thank you for being here.
Thank you. Bye bye. Bye bye. Bye bye.